Good afternoon, my dear students. I hope you are fine as me, and we are ready to study today lecture about heart. This is the heart anatomy, heart topography, and everything with develop and malformation of this very important organ. Let me see how you hear me. As usual, traditional question. Please give me feedback if you are fine and everything is clear. Okay, thank you. So let's start. Today's topic, as I said before, is functional anatomy of the heart. I'd like to start with saying that the heart is the most popular organ because even children have an idea about heart location, where in our body heart located is. And I can add that heart is a very sensitive organ. It is sensitive to emotional state of a person, and you know, in our life a lot of situation when we feel how heart beats and how it reacts to the some situation, very special and difficult situation in our life. And sometimes heart is endowed with the special properties, with special options that it doesn't not possess from a scientific point of view. And you probably know some expressions: the heart trembles with joy, or the heart, our heart, my heart shrinks with pain. Sometimes you can hear that heart freezes with fear, and many lyrics, many poets call the heart, our human heart, the organ of life. Also, doctors and especially students have a completely different opinion on this matter. I remember when I had exam here in the morphological department, and it was an anatomy exam, and I asked one student to bring me organ of life. Maybe you guess what these students brought to me, and it was not hard. Today situation with the heart in medicine, in basic science of medicine, everybody knows that heart is the most important organ in our body. It is the first organ that shows signs of life in embryo. It happened about fourth week in embryo life. And you probably know that when our heart stops, almost instantly death occurs. and knowledge of the heart structure and heart function is very important for doctors, or for all specialties, for surgeons, internists, pediatrists, everybody, even stomatologists. And but what is strange, a sick heart has long been the subject of comprehensive study, and cardiac surgery and interventional arrhythmology are progressing every day. And a long time ago, heart-lungs machine was created for cardiosurgeons. They also often carry a heart transplantation out, and new types of artificial heart valves are being produced. However, paradoxically, that doctors often know much less about a healthy heart than about a sick one. It is not right. It is not correct when we know a lot about sick heart, but we sometimes, I mean, not me, but you and doctors, they don't remember what is a normal structure in heart, because only just good knowledge of the anatomy and physiology of the healthy heart will make it possible to find a new effective method of treatment and prevention of cardiovascular diseases. And you see the picture of different specialists, special doctors treatment thick heart. Interesting expression I can show you. This is the expression of famous doctors in in the 18th century. Professor Sergei Botkin, it is very famous here, and this doctor said, when I attend the autopsy of a person who died of heart disease, in half of the cases I cannot understand what he died of, and in the other half of the cases Botkin didn't understand how this patient could still live with such a problematic disease. It is interesting because, and it is an idea which is improve the thesis about the heart is the most important organ in our body. Regarding mortality, you see that it is a real and serious problem in medicine. We consider heart and blood vessel diseases as the killer number one in the world. According to the World Health Organization, among the adult population of the planet, approximately 29%, so it is more than every fourth man or woman, fourth people, died from cardiovascular diseases. Mortality in diseases of the heart and blood vessels remains the highest, and today it is about 50%. You see that this is all is cardiovascular disease, and 51% for today. That is the heart diseases. That is a problematic. And I think it is very interesting for you study normal anatomy and physiology of the human heart. This is the issue of our lecture, and we in the end of the lecture we will talk about development and also congenital malformation. This is a special kind of heart diseases, very serious, which pediatrics medicine pediatrics should care and treat. Okay, and start with the internal anatomy and heart organization. As you see, heart is another name, Latin name is core, and cardia. That is a Greek term, and sometimes we use it in different situations in clinic medicine, like cardiology or cardio monitor and something else. What is this? What is the heart? This is a whole muscular organ that carry out movement of blood in the body through constant rhythmic contractions. This is like a pump, like a life pump, never stopped life pump in our body. And the heart is the central organ of cardiovascular system. As you see, classification, the cardiovascular system, you see the heart is the central organ, and another part is vascular system. This is a two kind of vessels. Blood vessels, they consist blood, and lymphatic vessels, they consist lymph. The blood vessels that carry blood from the heart to organs and to tissue, we call arteries. And another vessels that carry blood to the heart from organs, we call veins. This is the two kinds, arteries and veins. A couple of words about heart shape. Heart resembles as an irregular cone. It doesn't look like the one painted on the Valentine's Day card. Usually students present this Valentine's card on 14th February, maybe in your country, or maybe you guess, you know this tradition, but nothing with the shape in Valentine card like this. Nothing. This is just five types of heart shape. First, that is elongated. It is about 16%. Oval shape and conical shape. They are in equal portion. A, B, and A, B in Russian. Sorry, it is Russian letters. And you see, this is almost equal percentage. Often we could find spherical shape, about 41%, and sometimes we find undefined when the shape is like spherical or conical. It doesn't possible to understand. So it is only 7%. Next slide show the different part of the heart. This is the base, this part where begins the large vessels, we call base of heart. And another small conical structure we call apex of the heart. It is here. Then it is also 4 heart surfaces. First is anterior. Sometimes we call it sternocostal because it touch to the sternum, the osternum and ribs. Another second is inferior or diaphragmatic because heart is located on the muscles, phrenical muscles or diaphragm. We could also see left pulmonary surfaces and right pulmonary surfaces. They touch to the lungs, right and left. And about heart size, I can remember the English physician Laennec. This is a man who invented a stethoscope. This is some tube where in the past doctors used to listen the heart or lungs. We call it stethoscope. Special term. Now doctors use phonendoscope, but it is almost the same idea. And this doctor suggested, Laennec suggested comparing the size of a person's heart with the size of his fist. You can see on your fist, flex your finger together on your hand and see the shape of your heart. It is easy to compare. There are several main dimensions and several sizes in the heart. First, length, width, and thickness. And you see, here is the length or longitudinal size. Usually it is about 12 or 15 centimeters from the upper part. Usually doctors use the end of the upper border, and the lower border is the apex. So 12 or 15 centimeters. Next size is width, and it is another name transverse size, about 9 or 11 centimeters. And the size between anterior and posterior wall of the heart is the anteposterior size, and it is the smallest distance, about 8 centimeters only. The weight. How much is the heart weight? This is usually 1.5% of the body weight, and usually for men it is 300 grams, but for women, of course, it is less than in men. 220 grams. It is the normal weight normal weight of the heart. An increase, sometimes we see increasing weight of the heart, and this is in this situation and these symptoms, physician and anatomist called hypertrophy, when the weight is more than normal, hypertrophy. And opposite condition accompanied by decrease in the mass, we call atrophy. It is a rare situation. Usually in the life cycle, in the life period, we often registered hypertrophy. And idea that shape of the heart, its size and weight, all of those parameters are not constant values, and they changed depending on a person's age, gender, lifestyle, and health status as well. Next, what I'd like to next information I'd like to share with you, that is the heart chambers. And human heart, like all mammals' heart, has 4 chambers. 2 chambers of the heart into which the large veins flow are called atria. We distinguish between right and left atria, right atria and left atria, or light this is in plural, left atrium and right atrium. And another 2 chambers that push blood into the large arterial vessels are called ventricles. Here you see right ventricle and left ventricle. The atria here, between ventricles and atria, we could find 2 openings, through the blood come from atria to ventricles, we called atrioventricular openings. Atrioventricular openings. When you come to clinic, you could hear the terms right heart and left heart. Right, what does it mean? What do they mean? Right heart, this is the right heart here in blue, refers to the right atrium and right ventricles. Here is right, usually it is right atrium, and this is the right ventricle. These chambers located to the right of the heart axis contained oxygen poor dark venous blood, like a cherry, or like Bordeaux color. And we usually put blue color of these chambers. The left heart refers to the left atrium. Here is the left. It is not visible because it's the same color. Left atrium here, and left ventricle. Left ventricles. You see that is a different form. Right ventricle is like V, but the left ventricle is like a O, like oval shape. And from the physiological point of view, the left heart contained oxygen-rich arterial blood, like red, like a real red color. So, and you see that in mammals' heart, as well as in human heart, it is not possible to mix blood into right chambers from the blood with the blood from the left chambers. Get it? Okay. Next is computer. This is CT scan, and visible all heart chambers. Take a look. You see the right atrium here, in this position. It is a horizontal section, as shown here, and this is the right ventricle here. Left atrium is behind of right atrium, as well as the left ventricle is behind of right ventricle. So, from this point of view, we should to call right ventricle and atrium as the anterior chambers. Not right, but more typical to call them anterior chambers. And left atrium and left ventricles we consider as the posterior chambers. But when anatomy starts, when it was very long time ago, it was no computer. There were no computer, CT scan and CT computers. So in ancient anatomists call right chambers and left chambers. Okay, and we will continue to call those chambers as right and left. It is a typical, and we all used to do it. Okay. Next slide, where we see open atrium, right atrium here and left atrium. This is from right point of view and left point of view, and you see that all right and left atrium has two parts. This is the three portion of atrium. Venosus, thymus. This is the place where big veins flow to the heart, to the atrium, and usually this is sometimes very restricted or small area. Second is the atrial cavity, the largest part of atrium, and the third one is small appendices. This is the atrial appendage. We call them auricular. This is a small protrusions of the atrial wall. You see auricular in right atrium, and also you can find, and we can see the left auricular. The wall, the heart wall thickness in the auricles is significantly less than the other part of the heart. Sometimes it's possible to use special instrument and come into the interatrial cavity through the auricles. And also left auricular, you see, it is not visible here because it is a scheme. Left auricular has a more complex shape, usually like a worm or like chicken wings sometimes. And in the cavity of left auricular sometimes form thrombosis. This is from blood, and they come into the blood flow, and is the case of difficult and very hard diseases. Take it in consideration. Usually, volume, atrial volume is about from 4 to 8 milliliters. It is not more, it's not much, but that's it. Next, those are ventriculars. You see two parts of each from right and left ventricles. Here is the right ventricles, here is the left, and the final or end part we call arterial cone. It is visible better on the right ventricles, but also we could see arterial cone in the left ventricle. Another big, the more or biggest part of ventricle we call ventricular cavity. It's about here, and together. Arterial cone and ventricular cavity from in right ventricle is from 60 to 130 milliliters, but left ventricles is from 30 to 105 milliliters. Visible that the volume of ventricles is more than in right and left atrium. Between atrium and between the right and left ventricles, we can find interseptal or interatrial septum. Here is interatrial septum, but here big part. This is interventricular. This is between ventricles, and this is between atrium. And if you see from the side of right atrium, it's possible to find the place, oval shape, we call oval fossa. This is a real, let's come back and see here. This is an oval fossa. What is it? Oval fossa. This is a it remained, or the place. It was a real opening in the fetus through which blood flowed from the right atrium to the left atrium. This hole, with the normal development of the newborn, is overgrown by 5 or 7 weeks. It's closed, and then we only could see the oval fossa. And here is also visible oval fossa. This is a part of interatrial septum. What about interventricular septum? There are two parts of this anatomical structure. First one is the membranosus part, because this is no muscles inside, only connective tissue here. And second part of interventricular septum is muscular part. It is a typical with a cardiomyocyte, and it is a muscle, and it is visible. Usually problems with the heart, with the malformations in the heart, located in the first part, in the membranosus part. Usually is a defect here, and we call this as a congenital malformations. Not in the muscular part, only in connective tissue, only in membranosus part. Well, next issue is the heart topography. If we take a look on the heart in the chest, that heart position, we see that if we make sagittal plane, you see that the most part of head is located left, but less part located right. So it is a non-symmetric location heart. Mostly it's located from the left side. And in different people, different person has a different position of the heart. Sometimes it is a horizontal position like here. Sometimes it is like a drop, or it is a vertical position, and sometimes that is intermediate or oblique position. Usually horizontal position is about when this is angle is less than 40%. Well, this angle is less than 40%. For vertical positions, this is more than 65 grade. And between 40 and 65 is the oblique position. There are 4 heart borders. This is a projection. Usually that is the projection of the heart to the anterior thoracic wall. And in clinical practice, it's very important to know and be able to determine the skeletal peak boundaries of the heart. Usually in clinic and in anatomy, we distinguish the upper border or boundary, right border, left border to the point of apex location. Please, I'd like you remember this position, and it is easy to touch the apex of your heart in fifth gap between 5 and 6 ribs. Usually it is the left side. Don't be surprised if you find your heart is located here. It is very rare situation, but it's possible. No, but usually more often, more often, the apex of the heart located. If we take line, medioclavicular line, this is a clavicular, maybe you remember, I guess you remember, and this is a line which come through the center of clavicle, usually this is the center, and the apex is the gap between this line and apex chord is about 1.5 centimeters. Here is visible, and then sorry. Right upper border, right position of the apex, left come from the here it is the oblique position, and not visible boundaries is lower border. Usually the upper border is between the chondral part of the third ribs between here. This is the third ribs, and this is the upper border of the heart. Right border is about 1.5 centimeters from the lateral to the right edge of sternum here, between sternum here, and this is about 1.5 centimeters. And from 6 ribs, from the connection 6 ribs to the sternum, this is invisible lower boundaries of the normal heart. Very important to understand the shadow, heart shadow in radiography. It is very popular type of X-ray examination. Usually we often use this method to see if to see the problems in lungs, usually tuberculosis or cancer or pneumonia, especially here when coronavirus is under control. We have to control the problems after coronavirus disease. And you can also see the shadow, the heart shadow here. And this is a scheme, this is a real radiography of the heart. And we see aorta, the large, very large vessels here, aorta. Then we see superior vena cava. It comes to the right atrium, and this is the right atrium. Unvisible the border of right ventricles, because it is on the surface of diaphragm, and under diaphragm this is a liver. Here is liver, and it is not possible to see gap between heart and liver, because that is a massive parenchymatous organ and almost the same density for X-ray. From the left side, we also see aorta here. Then this is the pulmonary trunk here. Usually it's better to see here. This is the pulmonary trunk. Then small arcuous. This is the left atrium, and biggest part is left ventricle. It's very easy. You can see almost all chambers and big vessels attached to the heart for in radiography examination. For in human heart, in human body, we could find two circuits. It's called a specific term, circuits. This is a path or way how blood move in the body. We distinguish big or systemic circuits and small or pulmonary circuits. What does it mean? This is this heart. You see 4 chambers: left atrium, left ventricle, right ventricle, and right atrium. 4 chambers. From the left ventricles start aorta. It is here aorta. It is the biggest vessels in our body, and aorta starts systemic or big circuit. And the blood contains a lot of oxygen. This is a rich oxygen blood. It's come to different organs, to stomach, lean intestinum, tenue, liver, and everything, muscles. It's come to the brain here, to the tongue, throat, everything. And in capillaries, the oxygen come out to the tissue, and carbohydrate gas, CO2, we usually call it in chemical form CO2, come to the venous blood and through the vena cava superior and vena cava inferior from the lower part of our body, come into the right atrium here. So the systemic circuit start here in left ventricle with the aorta and finish in right atrium with the vena cava superior and vena cava inferior, 2 veins. This is a big or large or systemic circuits. But there is also and small or pulmonary circuits. It starts from the right ventricle, from here, and the vessels, arterial vessels, we call pulmonary trunks here. It's visible that pulmonary trunks contains the poor oxygen blood with a lot of carbohydrate combination, and it's come to the lung and divide into the left and right pulmonary artery. It comes to the lung through capillaries. Oxygen come into the blood. Carbohydrate come out in the external air, and then 4 pulmonary veins, 1, 2, 3, and 4 pulmonary veins come into the left atrium. So pulmonary circuits start in right ventricle and finish in the left atrium. This is a very typical, and taking consideration, you have to know the beginning and ending of the pulmonary and systemic circuits. I hope you will. Next slide is about heart work. Let's take a small analysis. Heart work consists of 3 phases. This is the 3 phase. First phase we call atrial systole. What does it mean, systole? Systole, when it is a contraction, when muscles, cardio muscles contract, and it is visible in red color. When the volume of the chamber became less because muscle contraction, and blood come into another direction here in the ventricle from atria to ventricles, and the duration of first phase is about 0.1 second. This is a very short period of time. Second phase we call ventricular systole, when both right and left ventricles contract, and they push the blood into the big vessels, into aorta and into pulmonary trunk. And this is first phase, but it is not very important. Second phase, just you should remember that is a period or phase for ventricular contraction or systole. It is about 1.3 second, also less, but 3 times longer than atrial systole. And next, the third phase we call common diastole, when no contraction in atria, no contraction in ventricles. That is the just passive flow blood into first into the atria, and then it starts to come into the ventricles. No contraction, and duration is 0.6 second. If we analyze the heart work, we see only 40% first phase and second phase, only 40% our heart works, but more time, I mean 60% of time for one cardiac cycle, our heart relax, and this is very interesting because we know the heart is very hard worker because it is a never stopped pump in our body, and but 60% of time this hard worker relax and have no contraction, and only 40% it contract. So it's very important. This is very important fact of physiology, and you should remember that resting should be longer than walking time, and but it is also only for physical dynamic, not for brain. It is for physical work, for hard work, muscle work, but not for brain work. Work brain can be longer. Okay, and usually one cardiac cycle is about one heartbeat per second. It means that normal heart rate is in the resting, in the when we don't run or don't play piano, I don't know. Only in resting moment, the heart rate is from 60 to 80 beats per minute. That is normal. And when we when heart in resting period is more than 80 beats per minute, we call it tachycardia. But when it is less than 60, we call it bradycardia. This is a small video with explaining heart. I think it is not in English. Yeah.
Сердце,
Sorry.
расположено в грудной клетке между легкими, это маленький полый.
Let's see this video later when you start to speak fluently in Russian. Okay, heart valves. What is it? For what? As I said before, heart is works as a typical pump, and in engineering, usually structure that provide one direction flow called valves. The same structure we can find in our heart, and they call heart valves. We have two types of heart valves. Cuspid valves, they located in the atrioventricular openings here. This is a quite big hole, and they located this cuspid valves located between atria and ventricles here. Atria and ventricles. Another type of valves we call semilunar valves. They are located in the beginning of aorta, in aortic root here. It is not good visible here because, but very good visible the semilunar valve in interpulmonary trunk. This is the picture of cuspidal or cuspid valves in the heart. There are two kind of cuspidal valves. First, we call mitral valves between left atrium and left ventricle here. And this valve has usually two cusps. More often, telling true, more often we could find three cusps in mitral valve, about 50%. This is dates information from Bykov and Kromov, 1969. And why we call mitral valve? Sometimes another name is left atrioventricular valve. Because mitral, that is cap for metropolite. This is a religion position in the church position, and this is a special cap or I don't know hat for this metropolite. And the name for mitral valve was done very long time ago because it is visually looks like a mitral head. The tricuspid valve located between right atrial and right ventricle. This is right valves. It is a little bit less and has three cups in 25%, but more often 4 cups, 35%. Usually, but traditionally we call it tricuspidal or right atrioventricular valve. And visible, just I draw the different three cuspids here, and all of cuspidal valves has except cuspids, they have chorda tendina. This is a connective tissue structure follow to the papillary muscles, and usually quantity of papillary muscles more than quantity of the cuspids. And papillary muscles, they can contract, and through the chorda tendina is possible to move cuspids. That's why sometimes we call cuspidal heart valves as active valves, because they have active muscles. Another situation with the semilunar heart valves. They are located in aorta. This is a section of aorta. It is open, cut here and opened, and we see three semilunar cusps. Posterior, right, and left for aorta, and right, anterior, and left for the pulmonary trunk. This is the pulmonary trunk. sorry, this is in Russian, and this is the aortic semilunar walls. How they work? Usually, when blood come in the direction from the ventricle to the aorta or to the pulmonary trunk, the cusps move to the wall, and this is it go here like, and blood come very easy. When it tries to come back, the blood come into this sinus, and the cusps opening, and not possible. It's here good demonstration how walls work. Here, this is systola, atrium systola, and the blood come into the ventricles, but the pulmonary, semilunar walls are closed. And when systola ventricles, it is the blood come from ventricles to the aorta or the pulmonary trunk, and walls are opening. I hope it is understand. Here the name of different walls and cusps, but we don't we will not continue to study that. We will. Алёш, пришли что ли? Ага, хорошо. And that is combination of contraction, atrium contraction and ventricles contraction, and valves works constantly. Couple of words about heart valve. This is a heart valve, and you see three layers here. First one we called epicardium. It is from extra surfaces, and it is in combination with the fibrous layers called parietal pericardium, sometimes epicardium called visceral pericardium. Between them is the cavity, and it contains some fluid, and it is like a fluid in abdominal cavity, or like a fluid in thoracic or pleural cavity. It reduces the moving and how to say it's reduce it makes easy moving. Let's say so. And the biggest layer of the heart is myocardial. Special cells. That is a cardiac muscle tissue with some kind of lines through the but it is isolated cells, and it is a special muscular tissue here. The most important tissue in heart is the myocardial tissue. In atrium, it has two layers. Here visible only external layers, but in the ventriculars, the myocardial layers has three layers: external, internal, and intermediate here, and they come into each other in apex of cordis, and it form vortex, some kind of visible. Вот Николаевна, сейчас лекцию дочитаю, перезвоню, ладно? This is visible on the apex of the course. As you see, the thickness of right and left ventricle are different, and left ventriculus is broad and big muscular tissue, and in right ventricle it is less, because work of the right ventriculus that is a hard work for left ventricles, and right ventriculus is less, produce less work. What is the idea how heart contracts extra body? Like, let me show you. Sorry. This is a picture.
Here you can see the experimental setup you'll be using during the wet practical. The experimental setup contains an organ bar which holds a strip of cardiac tissue. This tissue is connected to a force transducer which detects and converts the contractile force of the cardiac tissue into an electronic signal which is passed through the power lab and ultimately displayed on the monitor. Before we look in depth at the experimental setup, let's have a look at how the cardiac tissue is prepared. First, a cane toad is euthanized according to strict ethical guidelines.
And
The heart is then removed and placed in the dish. As you can see, the heart is still...
I'd like to show this video because it is visible how hard it is. Some kind of animal, a small animal heart, which is isolated, but it is still contract out of body. So this is this idea is and contraction of the heart in extra body is possible because we have special cardiomyocytes here. We call them connective or another word. This is electrical cells. Here they are bigger and they have a light color, but also typical is here. Typical myocardial cells here. This is thanking to this bigger and electrical cardiomyocardial cells, is possible to see the structure in different parts of heart, and they in combination they produce special conducting system in our heart. There are nodules here, 2 nodules, 1 and 2, and a lot of bundles, like Bachmann bundles here, like Gis bundles, and the cruise inside of interventricular septum. And this is the conducting system help to contract and to contract cardiovascular tissue and push blood into big vessels. How it works? Let's take a look. This is also video, and you see how the electrical signal come from the first node to the atrioventricular node and then come into the ventricles. So idea of contraction, because the electrical signal come from the up to the lower part of the atrium, the vector of contraction is here, and blood come and contraction come in this direction. But with the ventricles, пришли уже? Сейчас, ну пусть подождет. The contraction from the ventricles come from the apex in this direction, and blood also come into this direction and come in the big arteries, aorta, and also to the pulmonary trunk. This is also a picture of conducting system and registration of electrical signals in conducting system we call electrocardiography, and this is usually this part of cardiography is atrium contraction, and this is a complex, QRS complex. This is a complex for ventricular contraction, and it is a typical shape of electrocardiography. It is very popular for internists and doctors, and every doctors have to diagnose, to see the right or incorrect problems with the heart through analysis of electrocardiography. Okay, and this is another sheet I told you before about this sheet, and we call it pericard. This is special layers which help to reduce the to make better moving of the heart. Okay, I'm very sorry, I have no time to continue, and I put the last part of lecture about heart development and the anomaly and malformation of the heart in English in PDF file in Moodle section. So let me thank you. Let me thank you for your attention. This is all for now. Your questions you can put in our section in Moodle, and as usual you can find the test there. That is open 1 hour from 60:30 till 70:30. It is only 5 questions. I hope you will be able to answer all of them. Thank you for your attention, and hope to see you next week in our lecture. Goodbye, my friend.